Think Ahead should really raise the profile of the profession, and it will raise the profile amongst potential social workers of the future who perhaps currently aren't thinking about coming into the profession, and that's very important. I think it will raise the profile of mental health and the glories of working in mental health in some ways, the personal rewards that come from that, and the possibility of having a really big impact on society. And I think that will encourage a lot of different people to think about the importance of that and what contribution they might make. I hope it will also relate to the ongoing importance of supporting social workers in their long-term careers. We want Think Ahead to be the beginning of long-term careers in social work and of creating new leaders, new advanced practitioners, people who are really passionate about the work in the future, as well as people who come and get a sense of what social work is all about, possibly go into other fields later, but will then have a very positive view of social work for the rest of their lives.
So I think it's really important to promote the area of mental health as somewhere that is much needed, but also as a profession where you can get great reward personally and professionally. And I think the importance of Think Ahead is to play a contribution in terms of really bringing that to the forefront. We know that the stigma of mental health has had its impact not just on people with experience of mental health problems, but also on people who work in the mental health sector. And initiatives like this are an important part of helping to break down that stigma and really just tell the story of what it's like working in mental health. It isn't going to be the whole thing, and it needs to be a part of a wider initiative that brings resources and proper indication to mental health as an issue and as a cause and leadership. But it will help to attract people, young people, who are considering a career in this kind of area, and will hopefully bring them in for years to come.
Great. And why have people not historically gone into mental health? Why hasn't it proven to be attractive?
So I think there's been a huge stigma around the issue of mental health from both a professional point of view as well as the wider stigma in society. And I think that certainly acted as a barrier for people. And I think there's also been to some extent a barrier and a similar kind of stigma around social work. So if you like, what we're trying to do here is to tackle two quite challenging stigmas almost at the same time. But I think what we're beginning to see as public attitudes change and as young people's attitudes towards mental health change, that this is possible, it's achievable.
We know what qualities social workers need, so compassion, empathy, communication skills, and an ability to relate to different types of people. People who come out of the universities mentioned in the IPPR report, some of them will have those qualities and some of them won't, just like any other group in society. What this report is highlighting is that social work isn't reaching out to graduates from those institutions at the moment, whereas other professions, such as teaching for example, are doing so. And this could mean that social work is missing out on a potential talent pool, a group of hard-working, demonstrably intelligent people who might have a great deal to offer the profession.